panel, Horses and Mental Health and Research. Pebbles, Tuberville, Lynn Thompson. Thomas. Okay. Did I say that? I do. As it's coming out of my mouth. Oh my God. Rebecca Vivanco and I said Pebbles and Caitlin Erickson, who is with Horses and Humans. No, Horses. Horses for Healing. I'm going to go take a nap after this, and they're going to talk about the research that's needed as well as the horse and mental health. So I'm going to let Lynn start out. I'd like you to introduce yourselves, and then we'll start the conversation.
Thank you, Lisa. Hi everyone, I'm Lynn Thomas. I'm the co-founder and president of Horses for Mental Health, which is a nonprofit advocacy organization that we founded in 2021 with the passion of what can we do to spread awareness even further of the impact horses can have in mental health services, and also what can we do to support the wonderful organizations who provide those services so that they can get the funding that they need to do the great work that they do and serve even more people. And so one of the ways that we do that is through producing videos. We collaborate with many different other leaders in our industry, including other training organizations. We collaborate with Horses and Humans Research Foundation. We have media partners, including EQUUS Network and the EQUUS Film and Arts Festival. And we also collaborate with the programs themselves who are providing the services. And we all together are looking to uplift this work. So, of course, one of the big things is that people don't know what this is and why should they care, especially if they know nothing about horses. Usually people who know something about horses at least have a little idea of like, oh yeah, I could see how this could be a benefit. But there's a whole lot of people in the world, and sadly a shrinking amount of people who know about horses and have had the opportunity to have exposure to them that would understand the benefit that they can have in mental health services. And so we're hoping to get the word out there by all of us working together. Each year, one of the things that we do is what we call the Seen Through Horses campaign. It's held each May. It's an awareness and fundraising campaign that we all work together to spread the word. And one of the ways we spread the word is through film, which of course the EQUUS Film and Arts Festival is all about too. So, but I'm going to turn it over to Caitlin, if you want to share about the great work you're doing, providing the services directly.
We thank you for your work. We love being part of the Seen Through Horses campaign. So my name is Caitlin Erickson. I'm the executive director of a local nonprofit here in Albuquerque called Horses for Healing. We provide mental health services utilizing horses to veterans, adults, children, and families, and everything in between. We were founded on the premise of providing an organization that offers opportunity for healing to our local community in a way that was not being provided. So not just with horses, but also being very person first and strengths based. And then when you show up, while we have the horses, which is the biggest part, you are met with what do you need? How can we help you? Instead of coming into a mental health agency where it's, here's what's wrong with you, here's your treatment plan, and then discharge. And people aren't getting the help they need. So combining that with horses and that approach has been really impactful in our community. I am a licensed clinical social worker first and a horse person even before that, so it all melds really beautifully, and we are just so blown away by what we see.
Hi, I'm Pebbles Tuberville. I'm the CEO for Horses and Humans Research Foundation, and we are about how horses help humans, as well as how humans can help the horses. Basically, we started out research-oriented, trying to fund all these different programs with the fact that there's research out there to support what they do. Because we all know, well, people in this room probably know how horses help us, but there wasn't any really evidence behind that. So we started out funding research studies about that whole fact. But since then, we've kind of evolved into the point that we were doing this research, but it really wasn't getting out there. So we had to put on the education hat and really go out and tell people understand it because this is evidence-based. So it's going to help you when you're looking for funding. You can say, hey, there's research that supports this. The problem is there also is a little disconnect with the fact that you have researchers who speak one language and practitioners who speak another language. So we had to be that conduit that's trying to get people to talk to each other and say, hey, this is good stuff, and you need to know how to communicate it to each other. So we also evolved into helping horses. We feel like horses that are happier are going to help humans better, so we need to be advocates for horses and their equine well-being. So that's kind of a little bit of what we do. Is, like I said, we've kind of evolved in the past 20 years into more education, but we also fund research grants.
Hello, my name is Rebecca Evanco. I'm autistic, and it's probably the least interesting thing about me. I'm the executive director of Wildwood, 501c3 nonprofit in Peralta. Wildwood is autistic-led, equine-inspired. Our focus is on programs, services, research, and horses. And we're the proud owner of a beautiful Mustang filly, yay, who we rescued last year. Research is very, very important to us. I hold a research PhD, and I just finished, about to graduate with a second master's in clinical counseling. And I told my husband, this is it, it's the last degree, I'm not getting any more, I've got 4 now. I've been involved in various research projects, mostly with Wildwood. For the past 3 years, we've been developing a new assessment instrument to better identify autism in women. So we've been working very hard on that. Anyone who thinks you can just throw an assessment thing up on the internet and call it research, that's not true. In fact, if we knew how much work was involved 3 years ago when we started, I don't think we would have done it. But anyway, we called the instrument after our mare, Radiance, of course, as one does. I mean, we've got our horses and everything. Having, during the process of getting my second master's in counselling, I've been involved in quite a number of research projects as an auxiliary level. Probably the most interesting one was one that was looking at the role of equines in autistic youth out of Colorado State, and I served on the panel on that with my good friend Temple Brennan. So we kind of thought that now I've got my degree, and we're getting out there, and I'm going to be let loose in the counselling world, God help us. We thought it might be a good time to start some research of our own. So we are in the process of developing a new project for Wildwood counselling. We're going to call it ecotherapy. We're going to launch it next year. We're also going to run a research project with it because we know the value of finding good, rigorous research in terms of the magic that horses can do, but to find some real evidence to back that up. So we're going to run a research program that looks at the difference between interventions with more regular, neurodivergent firming, of course, but more regular therapy versus equine therapy. And we're going to look at those outcomes, which I think will be very interesting. So that's about what Wildwood's doing.
Okay, now that we talked about, yeah, well, and actually, as I say that, if there's any questions or anything that you guys are interested in regards to what is the evidence behind the work that we all do, I'd like to also share that there was a project involved that clarified terminology and what would be optimal terminology to help make it clear about, because all these wonderful programs that are out there benefiting people through horses are offering different kinds of services. And so when it comes to research, it's hard when, you know, it's like, well, yeah, we have the horse as our commonality, and yet this is, you know, physical therapy over here. This is occupational therapy. This is mental health. This is therapeutic riding, which has therapeutic benefit, but is not any of those other services. And so, and why should that matter to the public, you know? So I just wanted to clarify that there are a lot of these different types of services, and part of looking for the evidence and compiling what is really working, being clear about what you're measuring, what are the outcomes, what are the populations, and who are the professionals involved in that process is part of that. And you have some?
off on the terminology. My dream is that we could get all the researchers to title their research studies, "An equine helped this type of person with this modality." So it would be very simple because you've seen it. Equines help children with autism through therapeutic riding. Horses help veterans with PTSD through this modality. So if it could be like, it would be easy to search, because the problem is when you're talking about terminology, we have it all over the board. And because horses are so cool and help so many people in so many different areas, you have all these different research studies that are published in different journals. For example, when she's talking about with hippotherapy, you treat someone with a PT, or a PT treats someone on a horse, or an OT or a speech language pathologist, that might be in the journal of physical therapy. Or if you treat somebody who is in counseling, that might be in the journal of counseling, general
Professional, yes.
yeah, so, and then if you treat them with something else, it could be in a different journal. So that there's so many different journals that you can be in. And plus, it's the discipline too. For example, up here we have, well, y'all are common, because you're in social work, both of you, but you have multiple degrees, so you're everywhere. So, in the sense of, if you're going to study how the horse helps that human, which discipline is it going to be in, and which journal is it going to be in. So that's what makes it also difficult when you're trying to do a literature review or find specific research. Now, I can kind of talk about a little bit about Horses for Human Research Foundation. Felt like, you know what, this is a problem and we need to help people out. So if it's open access, why don't we make a collection? So on our website, we have the Science Open Collection. I think we have like 650 articles about how horses help humans or about equine well-being. That's just articles that are open access. There are a lot of articles and research journals that are behind, we'd say, paywalls or pay doors. So that's what makes it a little difficult with the research aspect, because we know it's all out there, or people are publishing it, but it's not in one specific place because there's multiple different disciplines, as well as areas of study, so it's a little bit everywhere.
I just was going to speak to the trickle-down effect with that too, of like on the research level and funding level, terminology is hard, and we find that on the grassroots level, it's also hard for individuals coming to know what they want. I want equine therapy. Perfect. Let's assess that a little further though, right? And so we, on a local level, have compiled a list to help them determine that and help them find the correct resource, because it is so vast. And so that trickle down is, as research gets more terminology, clarity, I think that also helps the individual seeking help know, what is it I'm looking for? I want horses, but what specifically are they helping me with, and how are they helping me? So it's all trickling down very helpful.
I think the idea too of what Caitlin talked about in terms of knowing what one wants. Wildwood's case, for example, we specialize and focus on autism. It is autistic-led. We have expertise in autism. Path International's largest group of people it serves are autistic people. Just on a side note here, I probably feel I do need to explain why I say autistic people and not people with autism. I am autistic. I do prefer identity first. Autism is much a part of my identity as somebody with deaf community. I say a person with deafness. You say a deaf person. Well, I'm an autistic person. That's what you put out there. But being very clear about who we're serving, what we're doing, that's been very helpful to us at Wildwood. We cannot serve everybody. We cannot be everything to everyone. And so being very focused about what it is we're doing and how we're doing it, I think will be very helpful to the research community.
Just as an advertisement, Horses and Humans Research has $150,000. Now that doesn't sound a lot to you, but for a person who has to raise it, it's a lot of money. We also have other studies in, for veterans or teens with trauma, but there's so much that we could do as far as research, but you have to have the funds to be able to fund it. So it's like this vicious kind of circle. I think I kind of call it horse and human interaction, basically, because it's all about being with the horse and how that horse is helping us. So I think it can be any type of person, whether it's somebody who might be labeled with a disability, or it could be somebody who is a competitive rider, or someone who loves to be at the ranch with their horse. So it's basically about any type of horse-human interaction, and there could be a plethora of research done on it as long as we have the funds to be able to do it.
Yeah, I was going to say a couple of thanks to the Horses and Humans Research Foundation, because you guys were the first major organization to say this is important and to raise the money to make it happen and to inspire credible research that's going to be published. Because for those of us that's on the grassroots level, being able to go to funders and raise the money to do this type of work, we got to have the credibility. And we have a lot of great anecdotal stories, and that is a start, and that gets the foot in the door. And we have to have more than that. So HHRF has really been the kind of the premier leader in helping us move that forward. I will say too, on top of the wonderful resource that Pebbles mentioned, you can go to horsesinhumans.org. Is that your website? Or? .org is your website, and you can search for research articles. You can also go to Horses for Mental Health. So if you are doing a program specifically focused on mental health and personal growth, you can go to our Learn More tab, and we have a research summary you can download. It's just free. You can use that. But we actually just updated it, which I need to get that out to the world out there too. It had 41 peer-reviewed published articles, and it's separated by population type, and it has the abstracts and all of that. So in the 2 years, so that was 2 years ago, in this 2-year period, we just updated it, we added 40 new articles. So we're up to 80 articles. That it's nice because for a program, for instance, and I've used it just to write grants. Like, okay, now we can be able to say, yes, according to these articles, there's this many articles here that are supporting or at least showing that this is a promising approach for you to, I mean, let's face it, this costs more. It costs more to involve horses in these services. And we need to be able to justify it. And so we have that resource, at least on the mental health side, so we're not focused on physical therapy or therapeutic riding or occupational therapy or speech and language therapy. So we're not focused in those realms, but just wanted you guys to know that that resource is there as well. So.
And I have used it, so thank you.
Okay, yeah.
We appreciate it. But it really does make a difference. You know, we're talking funding and that sort of thing, but people want to see that. They want the anecdotal stories, and then when you can tie that together is where we have found the most success. Not just in grants, but also with your relationships locally with just donors. Fundraising is they believe in your mission, but having the research and data to back that amplifies that whole thing. And for us to not have to do that ourselves is very, very helpful. As a smaller agency, right, we can't fund that ourselves. And we don't need to because we do what so many others do. And we would love to contribute to that as much as we can. But, we appreciate everything you do, and it does make a difference.
Certainly research funding is a huge issue. We are very, very fortunate to have support, people who believe in what Wildwood is doing. The 605 autistic women who took part in this to date research on this instrument is testament to that. I also need to give a shout out to everybody who donates their time, who volunteers. who works without pay. There's a gentleman sitting there in the front row, my husband, Dr. Mark Everico, who has given thousands of hours in terms of research, as I have done as well. All of our research is 100% privately funded. We don't get any government grants, we don't get the funding, although we're doing that levels after the event. But for people who really believe in this, who believe in horses, who believe in what they can do, there are some really amazing things that can happen. I do think we do need to be less siloed in our efforts. We need to collaborate more, find out where we can join forces, because that's when we can have some real power to make some changes.
The silo effect is really difficult with research because everybody is in their own little area studying and they don't really share it, and then you have to wait for it to be published, and then it's published, and like 2 years later you find out, oh, this person did this study on this, and why didn't I get that? And that's one of our dreams too, is to have like this virtual bulletin board that you can put a sticker up and say, hey, I'm doing a study in this area, can you contribute, or are you doing this, or have you done a pilot study? Can we get together? Because if you have more numbers, the population in your study is going to be more valuable, reliable, which will be very helpful. And it's sort of like, there's so many things that I want to do, and I have a doctor in front of my name, which is kind of weird because Dr. Hubble's, like, who would make her into a doctor but me. But anyway, I digress. But there's just, I mean, so many things that I want to see as far as like how horses help people with Parkinson's, or how do they help them with dementia, or what about women who have fear of riding who are over 50, or people who are in remission of cancer. There's so many different programs and populations out there that we could do research with or on, but you know, it comes down to the dollar. The other thing that I would like to see too is a reduction in medication for like people who might be on anxiety medication. Do the horses actually help reduce that medication piece? Or somebody who might be depressed, or somebody who's on some other type of medication, does the natural ability to be around a horse and interact with that horse bring that prescription level down? So the pharmaceutical companies won't like that, but it's something that we need.
They probably won't fund that one. So just curious for those of you guys that are attending, and was just wondering, how many of you guys are involved in organizations that are utilizing horses for human benefit? Okay, so almost all of you. I think that's almost all of you guys. What is your interest in? Going into the next question, are you guys collecting any kind of data on your benefit that you're having for your clients? Anybody? Some of you guys are doing that.
I have a lesson learned though, because we came up with our own instrument and used it for 4 years before partnering with you and the Utah PA, and we thought, oh, this is great, we're keeping data and it's not valid and it doesn't count. So we lost 4 years not using the forms that are recognized. So
Thank you. That is a wonderful, and I think that's what's so important about having these discussions is to share the lessons learned. So one, utilizing instruments that fit for your population, for the outcomes you're looking to measure, and that are considered valid and reliable, right? Yeah, thanks. It's still information though, right? There's still that feedback that
we
you've
still
got.
use it like on our website and in our brochures, but if we're submitting for grants, like it's not really recognized.
Yeah. You guys, yeah.
We send out a survey be a cat.
It's education, because
Okay.
there's no research for us to find what we were looking for.
Okay.
Yeah, well, and just again, appreciate that we have that on our mind, first of all, that we consider that, and I think even if you're incorporating horses in other realms that aren't about benefiting humans, it's still about how are we measuring so that we can communicate the outcomes that we're claiming that we're achieving. Do you guys have any lessons or challenges that you've been through trying to collect your data or lessons learned from you guys?
I was about to say on our website, we have a checklist for research readiness, so that you can kind of go through and prepare yourself. That's very helpful that someone made through their mistakes. So I would suggest that as a resource.
The planning phase is really super important, and a pilot study is a really good idea.
I was about to say you can switch to horses because we're also interested in how humans are affecting the horses. We're actually, our last veteran study that we did, and it was done in Canada, they actually looked at both, which was great. And that's something that we're encouraging more of because we would like to see that interaction. And we also have a $10,000 grant. It's an innovative grant that's due next month for those who want to apply for that innovative. And it's something like a pilot study, so it can help someone go to the next step.
All right, well, yeah.
Wanted to ask about the irony, I would say, of research itself somewhat making things so limited in terms of what is being evaluated that it actually doesn't apply to the real life situation. So the controls become so tightly monitored that it actually, so for instance, a study that was done at a large university regarding equine therapy had to do with measuring hormone levels in the children that were undergoing the cortisol levels. Yes. How does that really deal with their real lives versus just getting off of the horse? So there is this wonderful thing that goes on with the equine experience that we all know about. And all of those things, those hormone levels in our dopamine and enkephalons and everything that go on up here, they all happen, but they're not measurable at the very moment. You try to draw an autistic, blood of an autistic, that cortisol level is going to go up immediately. It doesn't matter whether the horse is good or not. And so these are things that confound many of the research projects simply because the research is done in such a narrow focus.
Yeah.
I was about to say, you need to go to our website and read the application that Baylor just submitted for them to get the grant, because they're using technology to look at the head, at the brain.
Oh.
At the same time, they're using that same technology on horses. So that was, yeah.
So like EEG?
Yeah, it's totally above my head. So it's really, we knew that we should fund that because it's going to be a game changer. And when you talk about the ripple effect, when we fund something, we're hoping that it's going to make a big splash. And so that's why we were really excited about this last study.
So
But I'm glad we came back to you because as a volunteer, that's another whole aspect that we would love to research too, is how the volunteers being effective in these types of programs, you know? I have an anecdotal story. I actually saw it on the news about a sidewalker in a therapeutic riding program, and she was diagnosed with cancer. And she told her rider that she went with every day, and she said, I have to quit for a while, I can't be your volunteer anymore, but I have to do this treatment. And he said, you know what, I'm going to be here waiting for you when you're through with your treatment. So, don't you think that kind of pushed her a little bit more to get through that craziness that it is with cancer? So, I would love to see how those are being affected too, because it's and the problem is when you're talking about variables, there's so many variables, and so sometimes when you're getting to research, you have to pull some of them out just so you can figure out what is being affected by what. So that makes it difficult with the research piece.
One thing that was mentioned, sort of a wider range too in the research. I would love to see more emphasis on older adults. There's a lot of work being done for kids. Speaking of anecdotal stories, we had a retired psychologist who had advanced dementia. Her children brought her down for an experience with one of our horses, because she had horses when she was younger. We actually got this on video. I'm so glad we did, because she was taken out in a wheelchair, and a digger, our chose her and walked up to her. And initially she didn't respond, but then she turned to him and she started patting him on the nose and nodding and smiling. And then she spoke. She said, she asked what his name was, and she hadn't spoken for nearly a year. She died a week later. But that experience was just incredible. If we can capture some of that with evidence and research, that really does start to look at the whole medical model of how we're treating people, how we're treating mental illness. And I love this idea about the medications. I'm going to steal that and put it into every program.
Yeah, we're funding a study actually in France last year that are looking at people who've had strokes. But the bonus part is they're also looking at the caregivers, because I think sometimes we forget the people who are our support team, and we really need to do something for them as well.
Are you running research that's being done at all with palliative care hospitals or people
Hospice? I don't know any. I mean, I've seen, if you've been on social media, horses going into hospitals in that case, but I haven't heard specifically of anyone doing specific studies. Going back to the adult piece, you made me kind of have a flashback. I used to teach therapeutic horsemanship at a higher education. So basically, I was teaching college students how to teach therapeutic riding to individuals. And we had an actual therapeutic riding program so that they could do the practical work. And we had an individual who was a jockey, adult. He was a jockey and then he was a trainer. Unfortunately, he fell off with a helmet on a street. It was really interesting because it went, like if you have a stroke in your right brain, it affects your left side and vice versa. It went across this way. So his arm was affected on this side, but his leg was affected on the other side. He was in a wheelchair at points in time, had a very difficult had a tough time ambulating. We put him on the horse the first time, and you would have never thought he had anything wrong with him. His muscle memory went straight to his riding position, and it was like he was riding like 20 years ago. It was amazing. And when you talk about an adult study, that's interesting because as somebody who was a rider, actually worked also with double amputee who was a rider, and put him on the horse, same thing, same position. He had a great position, so that would be interesting too. I just can come up with a lot of things if I could just get the money.
Yeah, I wanted to come back, is it Mark?
Yeah.
Your comment too. So I'm not a medical professional, and so when I hear about the research that says, oh, the cortisol level was lower, I'm like, okay, I have no clue how that matters or means to me, except for it's supposed to be good, you know? However, what is meaningful for me as a practitioner is the story like you just shared there, or what I hear from some of the programs. Okay, these veterans have a significantly decreased suicidal ideation in comparison to this. Now then the researchers go, but why is that? And then they start putting electrodes and they start trying to get down to the nitty-gritty of why that's happening. There's a research pilot study that was published by a psychiatric hospital, or it was taking place in a psychiatric hospital with patients that had serious anger outbursts. So they were measuring the number of anger outbursts. The ones in the control group that got regular psychoeducation, there was another group that got therapy with dogs, and another group that got therapy with horses. And the group that had the therapy with the horses had significantly less decrease in anger outbursts in their psychiatric setting than the ones in the dog group and the psychoeducation group. That's like really cool information for us who incorporate horses, because guess what? Incorporating dogs is a lot easier and a lot less expensive, so why not just go with dogs? Why are we even doing it? So that kind of data is actually really useful, but then it's like, but why? What is it about the horses that made such a significant difference in comparison to these other wonderful interventions, right? So everybody had a little bit of decrease, but one had more. So I think it's that kind of research data that I guess is more meaningful for those of us who are in the practice, but then getting down to those more medical, let's get down to all the chemistry and all those things, yeah, the experts can continue to work that out and then maybe tell us in layman's terms why that, how that is. I don't know if that, any thoughts on that you have as well?
I think that's a great premise myself. That if someone can go farther or longer without, for instance, a medication, or they get off the horse, the jockey, and is actually walking better to his own, then measuring it and doing the things that are the things of true life that really matter to the client. They don't care about the cortisol levels either. What they care about is that they're able to walk a little farther or better or more balanced or have fewer outbursts of anger. Is that persistent? So, you get off your horse, you get off their horse at that therapy program, you go back to real life in the city, and all of those things are back on your hours, back within a day. Or are they not back in a week, a month, 2 months? That surveys, yes, that surveys at intervals that can help with that very information. Those are very important things, I think. I don't know what you want.
100%, and that's exactly the kind of questions that research can answer, so that when the funders come to you and say, is my money, okay, that's nice that they are well behaved, their behavioral issues have decreased, or when they're sitting on a horse or around a horse, but how does that impact the long term?
Right.
And that's the kind of questions that collecting data can
Yeah, so based on that, one more anecdote. So we had an autistic child at one of our programs who didn't want to be anywhere near the horses when she was there, and didn't want to hold the brush. Didn't want to, and Rebecca said, "Okay, we'll just call your mom and have her come pick you up, and it's all right. You just won't be able to come back to the program. It's okay." So she sits there.
Yeah, we had some volunteers who were coming up to us and said, "Do you want a hug? Do you want a hug?" And she said, "No!" And I said, "No, she doesn't want it. We're having a PDA issue here." Just no, don't touch her.
By the end of that day, she got onto our 17 bus and perched her on the Andalusian cross, Odin, and was riding that horse with the sidewalk. And there's more. So a week later, mom comes back in tears. Her dentist had scheduled regularly 4 hours for each visit. And the dentist came out within 40 minutes and said, "I'm done. Is this child on drugs?" And the mom says, "No." And he said, "What's happening?" And the little girl says to the dentist, "I don't know. I mean,
And it's the state.
So I also co-founded another organization called Reading for Change, and we focus on having a story lens in this type of work. We train professionals how to do it. But you just kind of almost did a highlight of when our stories change, we change. And you changed that child's story, and she's able to now live her life in a different way. And I feel like that's what a lot of the relationship with the horses are doing, is they're changing something at a cellular level inside of us. And research back that up. That's but we have so much anecdotal, and actually we collect enough anecdotal, that can be research in and of itself.
Yeah, I'm hoping to work with other foundations that work with certain types of groups. Parkinson's, Michael J. Fox, if anybody knows outlining him, or the foundation, let me know. But one study I was really interested in is MS. Kind of going back to the story piece, we had a group of ladies that had MS, and they all had it in different degrees. But this one lady, her leg would go numb, just one leg. And after she rode, she could feel it. And like, when you say, how did the horse do that? She would go work out and do other things, and she didn't have that sensation come back unless she was on the horse. She begged us to ride twice a week just so she could feel her leg the whole week. Of course, we let her. But that's an amazing piece. But how? And so that's why that's our biggest question. Like, how does that horse help that human?
the other thing about that is that it's very interesting because very much like the trainers who are showing people how to gentle these wild horses, it doesn't necessarily transfer. So they have done that for decades and are able to do that. It is like magic in a way. It looks like magic. It isn't, but it looks like. Individuals, another person with MS may not have that same effect, even though their same right leg is numb. It may not have that same effect. So it's because the physiology of each of us is so unique that anecdotes are actually very, as you had said, very, very important to collect those anecdotes and have almost like a clearinghouse perhaps for anecdotes. And even if it's video clearinghouse or something are there, I'm thinking, oh, AI. What? How can AI do something about that?
Yeah.
So,
you're alluding to the efficacy of the single case study.
yes, that's exactly, yes, yeah. So the single case study, multiple single case studies.
Yeah.
So, pretty similar people coming in. That means a sorting of types of people up front at the quote grassroots level. But sorting, oh well, so these people have, these 3 kids have a similar thing. So it's a group of 3. Okay. They have behavioral outbursts. Here's one group of 3. Maybe 10. But 10 there, and 10 there, and 10 over there. It's to be 30. So that it is not, if there is collaboration and communication at this level, here, right here and now, and going around, because that internet is a really cool thing
Yeah,
for
I'd love to see more
communication.
collaboration.
That if everybody exchanges their cards and says, watch my, but time, keeping up on Facebook with everything that's there, and all of that stuff, oh my gosh, and then you've got your kid is over here streaming or something like that. So, but we do the best we can with that. Sorry.
Yeah, I was just about to say, you do it.
Alright, well, I think we're about ready to wrap up for our time today. So thank you guys for joining us in the cause to increase more research behind the work that we do. And I think supporting organizations like Horses and Humans Research Foundation, because they're the ones who are taking part, because the rest of us are too busy, right? And we do need to be evaluating and collecting our data just from, I think, an ethical standpoint, that we are saying, yes, this is working, and yes, we are at least doing some sort of evaluation to say, yes, it's doing something.